All right. Well, welcome everybody to our event tonight or this morning, wherever you may be. We are going to have a very interesting event with several parts to it. So the overarching title for it is a briefing about the Global Life Sciences Healthcare Entrepreneurship Course, which I lead at UCSF. But we have some really interesting other things going on as well, which some of you may be here for. So we are going to start with an IP talk by Vern Norviel, who is partner at Wilson Sonsini. I will introduce him in a minute. After that, we're going to have the briefing. And then I've asked one of our alumni, Udara Kularathni, I always butcher his name, sorry, Udara, who took the course and is going to just comment on what it was like for him and answer any questions you might have. So we're going to be starting with our IP talk. But first of all, in case there are some of you on this call that don't know who UCSF is, University of California, San Francisco, we are very well known in the life science world as a scientific and medical powerhouse. In fact, Genentech, which was the first biotech company, started here. It started from one of our faculty members and who hooked up with a very early venture capitalist and formed Genentech. So we have a lot of history in this business. We have 7 Nobel laureates, and so the science that goes on in the halls of UCSF is very top-notch. And we have a top hospital system. We are actually ranked number 16 in the world, and that's really interesting because we are only an a graduate university, and we only do life sciences and healthcare. So we are stacked up against all the other universities in the world, and we come up as number 16. So I'm very proud to be part of this university and to share what we're doing in entrepreneurship with you. So I want to introduce Vern. I'm going to stop sharing my screen now so that he can put up his slides. Vern Norviel is a partner at Wilson Sonsini, which is a storied Silicon Valley law firm that it was known in the very early days of the tech world as having helped form some of the companies that you know very well. And they have a very strong life sciences practice because they're here in the Valley. Not only is he a partner at the firm, and I like to call him the top IP attorney in the world, here, and certainly he has tremendous knowledge and connections in this world of IP. He's also a startup founder. He is an advisor to a venture capital firm. He teaches at Stanford and has taught at Berkeley. He teaches at UCSF in the global course. He's on the board of Scripps Research. He's on many, many boards, and there's just not enough time to list all the accolades that I have for Vern. His JD degree is from the UCSF School of Law, and he has a master's from the University of Santa Clara. And with that, I'm going to hand it over to you, Vern, and thank you so much for being part of the program tonight. If we can find Vern.
Vern, I think you're on mute, Vern.
Okay, back to the program, sorry. So I'm humbled to be involved with all this. It is quite a remarkable university. I always say that I think of all the stuff I've done, my parents would probably be most proud of the fact that I'm involved with something, a place like UCSF. So that's good. So interestingly, this is kind of a life thing that I carry around with me, this T.S. Eliot quote. It was supposed to be in very small font, but somebody, when they reformatted my slides, made it big. And I decided that was okay. And this is kind of what I've gone by for the last 40 some years of my career, that only those who risk going too far can possibly find out how far one can go. I think that's especially true in the life science industry, both in science and in business. So the things I'm going to go over today are the 5 big IP mistakes, the patent law mistakes, I should be specific, that people make when they start a university, a company from very frequently a university. I see these 5 things pop up very commonly. And so it's probably worth just putting some flags out there for you to keep in mind. The 5 things sort of, I'll go through each of them individually, but the 5 things are that I see pop up are, believe it or not, ownership of the patents. This has actually become a very big issue in the industry. VCs are very sensitive to it. Partners are very sensitive to it. It seems at first blush like it would be really clear who owns a patent. But of course, whenever lawyers are involved, things tend to not be clear. And this has become a very big hot button issue. The other thing that you always have to deal with when you're starting a company is, do I infringe someone else's patents? And people frequently do what are called freedom to operate studies. They very much fear these and they view them as somewhat controversial things. But I actually try to flip that around and say it's not a freedom to operate study. It's, can I find anything that is out there that I could use to help build my business? And so I've come to call these finding loose bricks studies. The third thing I've seen startups not do perfectly is kind of a fairly basic thing, which is these patents and so forth are very tedious, I know, for scientists and business people to understand and read and spend time with. But critically, the material that you write down in these early days of starting a company is going to live with you for the rest of your life. And so I find not paying attention is a very frequent problem, which I'll go into. The next big mistake I see people make, and this happens even more, the more a person is bright, I believe the more they make this mistake, and they believe their inventions and their ideas are obvious. So I'm going to go talk about that a little bit. And then the last mistake is sort of a classical patent law mistake, is making prior art for yourself so that you can't get a great patent. So let's dive into them each individually. So again, ownership is something that you just wouldn't think is a problem. But it has become one of the biggest issues that VCs and large pharmas and partners worry about. I've seen the mistake come from several angles. One would be, I get a postdoc or a scientist from one of the universities, and they come from UCSF too, and they say, well, but I thought about this in the shower, so the university doesn't own it. It's very difficult to say that. And furthermore, these universities are very respectable places and should be honored. So trying to play a trick on the university is usually a bad idea. The universities own most of the inventions that the scientists come up with, and there's easy ways to deal with it by getting a license, so just deal with it. Another common story I hear is, well, they come over and they want to start a company and they want to meet with me. And the story begins with, yeah, I just left big pharma X or small biotech Y or university Z a few weeks ago, and I have this great idea. Well, the problem is that people usually don't come up with great ideas, particularly in life science, over a period of a few weeks. And this is the one that has generated lots of litigation in the industry. It is, you need to be very fastidious when you've left a previous employer about whether you might have thought of that before you left. And you need to sort of prove a negative here, which is you have to prove you thought of it after, not before. Proving negatives is always hard. So, but this has generated lots of lawsuits. Believe it or not, there's actually a new type of legal practice. I mean, there are lawyers that specialize in being what are called employee mobility lawyers. This has become such a big deal. There's a whole new law specialty around it. So whenever you're starting a company and some of the people are involved just left a previous employer, you just got to deal with this. The other one is, whether it's at a university or wherever, but it is, I am, say, a professor at some university, and I did this all myself, or with just one other person. In life science, it's becoming an increasingly difficult story to believe. Few things come up all by oneself. There's usually at least a few students or graduate students involved, but very frequently there are other universities involved. The scientists frequently collaborate with companies, and sometimes they're funded by grant institutions that have reached through on IP, such as the Juvenile Diabetes Research Foundation and so on. A really very visible problem here was found in the CRISPR patents, where the Broad had actually been collaborating with, I believe it was Rockefeller, don't quote me on that, and they kind of forgot to give them credence in the patents. That created all kinds of problems, especially in Europe, believe it or not. It actually created a bit of a problem on the UC side, but it was a problem they dealt with right up front. There were several universities involved. The University of Vienna, that's where I believe one of the scientists was. And then another person named Emmanuel Charpentier, who was at a university in Northern Europe, and they did not have assignment obligations. So the UC side is actually, the ownership is divided between Emmanuel Charpentier and the University of California, Berkeley. But they dealt with it up front at least, so they at least know what they're doing. The Broad, it kind of got found out on them. You've always got to start when you start a company and ask yourself, do I own the patents I'm going to be parlaying about as part of my business model? Now, the other thing that investors and anyone else involved will always ask is, do you infringe anyone else's patents? Usually this is dealt with by doing what's called a freedom to operate study. If you don't do it, the VCs will. But the weird thing is that I found that there's this knee-jerk reaction to think of it as finding problems. But if you turn that around, it can much more commonly be dealt with or thought of in a more positive way as finding, there's a misspelling there, sorry, finding assets, not finding problems. Frequently, when you find a patent that maybe covers you, it's owned by a university and you can license it exclusively and make it one of your assets. Sometimes it's with a failed company and you can just buy the asset. Sometimes it's owned by individuals. There's a very famous company named Guardant that does the cell-free DNA cancer assays that many people get. And it turned out there was a guy that invented cell-free cancer DNA analysis. He was a medical doctor in Switzerland named Dr. Strohn, wonderful fellow, and he owned the patent, and Guardant just bought it from him, turned it into an asset. The main thing is you want to find these, what I call loose bricks, before your competitors do, because if you have a competitor pop up, they'll have a lawyer like me, and they will find them, and they will go license them or buy them. So if you don't, somebody else will. The next big trip up I see young companies make is they don't read things carefully. The materials that you submit as part of patents are going to be analyzed, if you're successful, by dozens or maybe hundreds of lawyers and scientists in litigation someday. So you really need to pay attention to what you're reading. You need to take, it's a lot of time, it's hard, it's, you wear yourself out reading these things sometimes. But you've got to deal with them very carefully, because if you don't, again, any errors will be found out, guaranteed, in litigation someday. You also need to have a basic understanding of IP law. I just can't think of a successful scientist that started businesses that doesn't have a pretty good to an extremely good understanding of IP law. I would say the same is true with venture investors. Some of these folks are as good of IP lawyers as many IP lawyers. So this industry requires that you be on top of the IP. It requires that you read everything that's submitted and take the energy to do so. As I mentioned here, when I hear back from an inventor that everything was good on a first draft, I know they've not read it. These things are never perfect on the first draft, and that just tells me they didn't really read it. So this is probably the most classic mistake a young entrepreneur makes starting a company, is they believe that everything they thought of is obvious. And once you've got something that's new, the smarter you are, the less likely it is that it's obvious. And most of the people that are on this call are probably very bright people. So my general rule is let the lawyers decide what is obvious or not. It's not in your tool house. Unless you go back and get a law degree on it. So my suggestion would be you think of everything that's new that you've done as patentable. You give it to the attorney and let them figure out if it's obvious or not. And then the last classic mistake I see is people making prior art that blows up their own patents. And the one that I really want to put a red star by here is grant applications. I don't know why it is, but it seems to be the common lore amongst scientists that their grants are kept secret, which is kind of true, except they are publicly available with the Freedom of Information Act once they're funded. And in theory, unless you've done a lot of things right and paid attention to this, everything is available under the Freedom of Information Act. But no matter what you've done for the whole grant, the abstracts are always publicly available when the grant is funded. And I just can't tell you how many times I've seen a grant application blow up a patent, whether I was fighting against the patent or trying to get the patent. The other one that seems to be a very common slip up is posters. I don't know why there seems to be a common lore that posters don't really create prior art. And especially it seems like scientists don't believe that when one of their students presents a poster, they don't believe it's prior art, but it most certainly is. And the other thing that has come up in one case recently is embargoed PhD theses. Believe it or not, even if a PhD thesis is embargoed, there are some universities whose rules are not sufficiently clear that they would prevent them from being prior art. One of those universities happens to be just a few miles from UCSF. And it turns out their standards are such that it might be true that an embargoed PhD thesis could be prior art, or at least it could be argued that it's so. So everything that goes out the door, basically, you have to worry about whether it's creating prior art for yourself is what it boils down to. These are three big things where I've seen people be surprised in just the last short while. And that's the end of my comments. I don't know, Stephanie, if the format is such that people could ask questions or should, and I think I'm pretty close to the end of my time anyway.
Stephanie, you're on mute. Sorry.
Great. Yeah, no, thank you. That was great. Very succinct and very pointed. I hope people were able to take these key points away with them. Really things that I see all the time, as Vern does, people just miss out on. And, entrepreneurs, first-time entrepreneurs, like so many in our network, and maybe some of you out there, just don't know these things, and they inadvertently make a mistake, and then it's too late. They put up a poster. I've seen this at UCSF in the lobby of Genentech Hall, and anyone can walk in, but little do they know that what this has just done to endanger a future startup. So very much appreciated, Vern. I wish we had time to do a bunch of Q&A, but unfortunately, we don't. So thank you for joining us and spending your time with us tonight. Yeah,
that's what the class is for. So it really is a remarkable thing that the university's done here, and it's pretty much unique thing in the world.
No, thank you for that, and I have to agree with you. It's a very special class, and I'm pleased that this is now the 6th time we've been able to hold it at UCSF and have people like you are surrounding it. So thank you.
Thank you for the opportunity, Stephanie.
Of course. Okay, I'm going to go back to share my screen, which actually, Inder, I'm thinking I'll just let you do it. Why don't you share yours,
Okay, give me one
which is mine.
second.
So thank you for those of you who have put your location in the chat. So we have people from Asia, we have people from the US. It's really great. And I am now looking to see, have you got it shared?
Yes, you
Okay.
should
All right.
be able to see it.
I see it there. Okay, great. Okay. All right. So now we're going to go into part 2, which is to talk about this class that Vern just referenced. And I'll tell you, we are so pleased to be able to surround ourselves with people of Vern's quality to help teach. I'll just quickly introduce Udara, who is our alumni representative tonight and today. And Udara, you can wave from the screen. You're not ready to talk yet, but I might be calling on you for some comments as I go along today. Great, so I will fully introduce Udara later, but I just wanted you to see him on the screen and know that he's here to answer questions. Okay, next. So what's this class all about? Our value proposition, this is a term you'll learn if you don't already know it in class, it's an entrepreneurship class where professionals, so it's meant to be a professional class, learn about science and medical startup businesses from Silicon Valley practitioners and become part of a global community. So there are a lot of things to unpack here. It's a professional class, science and medical only. Silicon Valley, you're going to hear a lot about that, and you will join this global community. Next. So I'm not going to go through all of this, but just putting it up on a slide so you can see I run the entrepreneurship program at UCSF. I also have the title of senior lecturer. My background is industry. I'm not an academic, so that I always bring the industry perspective to it. Primarily in early to mid-stage companies. I've done things with the NIH, NSF. I'm published in Nature. I'm in a Fulbright, and I speak for the U.S. State Department. So we can go on. So this is one of our early alums who, and we heard this from a lot of people, that this course has literally been a life-changing experience. Srivan is a sort of a mid-level manager in a biotech. And he took I think it might have even been cohort 1. And this is what he said. He's had a lot more to say than that, but I just wanted you to know that this course really does make a difference. Next. So how are we different than other entrepreneurship courses out there? We are exclusively life sciences and healthcare. This is not a tech entrepreneurship class. The Silicon Valley practitioners are the ones who teach and mentor. So we don't have any academics up in the faculty. We have people who are actually doing the work in Silicon Valley, people like Vern, who's a top IP attorney, we have somebody from FDA who is also in J&J. You know, every perspective comes from real world. So that's a really important point to remember. It's also a very high touch class. So it has a lot of interactivity, and it's both in the lectures. Like if that was a full 1-hour lecture with Vern or 2 hours, you would have a chance to ask your questions. And that's very important because you may not hear what you're hoping to hear, and you get a chance to interact with these very senior people. And in addition to that, we have small groups that meet. So they're developed by sector. So we have a biotech or therapeutics group, we have medtech group, we have digital health, and what am I missing? Diagnostics. And each of those groups is led by a mentor, and I'll say more about that later. we have the mindset and culture of Silicon Valley. So there's a lot to just being here and understanding how we think of things. It's a very different mindset and culture than most of the rest of the world that does entrepreneurship. It's a way of thinking about things, a way of acting as a CEO, a way of thinking about failure if that happens. It's a whole cultural set. There's been a lot written about this, but you will pick this up in this class because everybody that is teaching is from Silicon Valley. And then we have a very active global alumni network, and we'll say more about each of these things. So go ahead. Next. So why take it? Maybe you're currently working on a startup and there are gaps in your knowledge, or you're thinking about a startup and you want to learn more. You are a scientist and don't know business, or a physician and don't know business. You want to figure out, should I do a startup? I mean, it's not for everybody. And this course will help you understand whether you're a good fit. You will hear speakers talk about what it takes to do a startup and what the barriers are and what you have to accomplish. And you may come out of it and say, that's fantastic. That's exactly who I am. Or you may say the opposite. It's like, wow, I don't want to take this on. I'd rather go back to a predictable job and know where my next paycheck is coming from. So this will help you make that assessment. You'll also find out how to interest investors. So we all are going to need money to progress these startups, and investors are the way you're going to get it. So what do they want to know, and how do they think about things, and what is their process? They obviously can't invest in everything they see. So what's going to make you stand out? Another piece we talked about is absorbing the startup culture, and then building connections. And people have come out of this class with great connections that have led to all kinds of interesting things. And we now have quite a large alumni immunity. So every year, the connections get even better. So these are reasons to think about the class. Next. Quite a diverse group takes this class. So you're not all entrepreneurs or potential entrepreneurs. We also have faculty members who don't really plan to become entrepreneurs, but maybe they're coaching a postdoc or trying to figure out how they can become a founder. We have scientific researchers in companies, biotech companies, pharma companies. There are physicians. We have ecosystem managers, people who run things in an ecosystem, like maybe it's an accelerator, or it's a some sort of a group that ties founders together, or an innovation effort by what do I say, country. So we have had all those kinds of people in the course: tech transfer heads, corporate managers, pharmaceutical executives, startup advisors and consultants, government, people from government have come, including our government. And I see our FDA participant on the screen. And investors come, investors from other countries and from here. So very diverse, makes it a really interesting class. Next. This is Cecilia, who was in, I believe it was cohort 1. She's the founder and executive director of an ecosystem element in Hong Kong, the Innovation Forum. And Cecilia used to get up in the middle of the night for her, because half the classes are appropriate for Asian time and half are appropriate for European time. So the European time, which is 9 a.m. Pacific, doesn't really work well for people in Asia. But Cecilia would take a nap and she would get up at 1 p.m., have a cup of coffee, and join class. So I was really happy to have her. She was a great participant, and she, this is what she had to say about it, recommending it to anyone who wants to understand life science startups operating in Silicon Valley. Next. So now I'm going to talk a little bit about what you're going to learn. We start out with opportunity analysis. And this is something that is really hard for scientists and physicians to start with, because they typically start with their science or medicine, which is sort of backwards, because you don't know if what interests you in those arenas can actually be a business. And we're going to teach you how to figure that out. It's a really key component of this course, and it's why we start with it. Darren Cook, who is both an angel investor, is also a mentor at the Berkeley Skydeck Accelerator, and now runs a big program at UC Berkeley for entrepreneurs, is our speaker at this. Next. I get to talk about business models, and the concept here is, okay, you have an idea, maybe you have an opportunity, but how are you going to make money out of it? And because we're in a for-profit business, that's absolutely critical to figure out. So that's my class. Next. Some of you may have heard of Steve Blank. Anyone hear of him on this call? Maybe put it in the chat. Steve is credited with really having marketed, publicized, started the world of customer discovery. And from that came I-Corps, first to the NSF, and then the NIH working with us at UCSF. He comes and does a special lecture on customer discovery, and it's really from the guy who knows it all, because it was largely his concept. So Steve's always a great person to hear from. Next. Teresa Toller does team building, and you will learn that the team is one of the most important aspects of your company, not just for investment, but to make a successful company. So Teresa it sort of pops from company to company, startups building their team. And she also has worked for one of the major venture capitalists, just being available to them for any of their portfolio companies for team building. That's how we learn about it from Teresa, and she's really seen it all. Next. Intellectual property. We just heard from one of the big names in Silicon Valley. Todd Esker is someone that has taught with me for a number of years, first at UC Berkeley and now here. And he has a way of explaining intellectual property that you can actually understand. It's a very complex field, and he makes it sound pretty simple. So I love bringing him in because he just has a great way to dumb down, if you will, these very complex concepts. Next. FDA regulatory. Ilan Irony is an FDA guy, formerly. He was deputy director of the Division of Clinical Evaluation and Farm Toxicology. He is currently a global regulatory leader at J&J. So he's now seen this from both sides, from the corporate side and the FDA side. So who better to tell us about how the FDA works, what you need to know to be successful in a regulatory strategy. And it's really great to bring him back this time for the second time. Next. So now about investment. So where does the money come from? Well, one of the first ways you get money as a startup is from angels. And for those of you who don't know that term, these are high net worth individuals who invest their own money. So unlike venture capital, which is a fund that's raised from a number of corporate sources, angels are just writing their own checks. So it's really important to think how they think about things, how they look at things. And we've got two very diverse experiences here. Winnie Wan is not only an angel, but a board director, executive advisor and mentor. And she's a part of the Life Science Angels Group, which is a major sophisticated angel group here in Silicon Valley. And Ranjan Nag is director of MIT Alumni Angels. He also teaches at Stanford. He also has his own family office where he assesses deals and makes investments. So it says MIT, but actually this is an open group where anybody can pitch the group, who is made up of MIT alums largely. So they come at this from very different places and will have interesting perspectives. Next. Venture capital. So Jorge Condi is with one of the most famous firms in Silicon Valley and probably in the world at this point, Andreessen Horowitz. He is general partner and he is on top of the life sciences practice for Andreessen. So he is going to share how venture capital works and how you can get a VC interested in what you have, what they want to see, how they think, what their dynamics are, how they're assessed. Everybody has a boss. And so he's going to help you understand all that, which you really need to understand if you're going to be successful in getting venture capital investment. And not on this slide, we have another VC from B Capital, and he will have agree with some of what Jorge says and have his own different perspective. So you'll hear from two people in this class. Next. Okay, so strategic partnering. Partnering is essential for life science companies. It means generally means partnering with a large pharmaceutical company. You're going to need their kind of money and expertise to move your programs forward. And pharma needs the pipeline of programs that come out of startups. So it's a win-win, but it's very difficult to get a partner to be interested in what you have. And Leslie, who's a vice president of early innovation partnering at J&J Innovation, is going to describe it from the corporate side, J&J. What do they look for? How do they assess deals? How do you negotiate? And Pat Sinatra, who is a consultant and works for lots of biotech companies who need to partner, is going to talk about what it's like from the other side. And of course, as you can imagine, it's very different. So what's it like being a small biotech trying to partner with a J&J? And she will provide that perspective. Next. U.S. healthcare system and regulation. So again, we have two great speakers. Eyal Gurian used to be with one of the major insurers, which actually had another name before Elevance. And Elisa Melian is with a company. So again, two different perspectives, both great people for regulatory. Next. And then we have a number of entrepreneur stories. These are a couple from last year that we probably will switch up a bit, but it's really important to listen to people who are successful entrepreneurs. All of them had difficulty in the beginning and had their challenges. And so they'll talk about what their challenges were and then how they overcame them and what they see now. These two men have raised significant venture capital, Series A and Series B. Next. We have mentor-led discussion groups. So we talked about these small groups. These are the therapeutics, diagnostics, medtech, and digital health. They are each run by somebody from that sector. So if you are sitting with a diagnostic company and you just listened to a lecture on IP, but you're wondering, how does that really apply to diagnostics and how is it different? You can come to this group and get somebody from that sector to explain it all to you. And you can also really bring up anything you want to in the discussion. So many people bring up individual questions because of what they're personally doing. And we try to answer everyone's questions. So again, very high touch. Next. So this is our network. And it's amazing that in this very short time, we have been on 6 different continents, 37 countries. Hopefully we'll add some new countries this year. We have this active alumni community, and the meetups are almost all virtual because you're spread all over the world. But we do a few things that are in person. So you can learn of opportunities through this network. You can just get to know peers who may be struggling with the same kinds of things you are in a startup. Next. This is one of our only in-person events at JP Morgan Healthcare Week, which is maybe the biggest business investment event in the world. Happens every year. It's sponsored by investment bank JP Morgan, but really what they do is they have a Wall Street focused conference, which has entrepreneurs far more advanced than people on this call will be, pitch their companies to investors. But around that, a whole number of other conferences have grown up over time, and everybody just converges in San Francisco during this week, and we have an alumni event at UCSF. Next. So for the first time, we are offering a completion certificate. I apologize to the alumni who are on this call that you don't have one, but we struggled with this for a while. We want to make sure it's a valuable certificate and not just something that we hand out to everyone. So we do have a mechanism to do that now, and you will need to attend a certain number of classes, but this is something that you can be very proud of. Next. And just put this up to think about, Russ Ernst was in the last cohort. He's an entrepreneur from Boston, and he talks about the access you get is more than you could hope to do in years of networking, and you get it all in a 10-week span, blown away by the quality of the people gathered in one place. We get comments like this all the time about the value of the class. So I'm very proud to be able to offer it again. Next. Okay, some key facts. It starts October 2nd, runs for 10 weeks. It's 2 hours a week is the lecture, 4 hours a week, maybe if you want to do the reading and come to some of the small groups. You don't have to do any of it. It's all there for you if you want it. It's both live, online, and recorded. So if you can't make a class, even if it's in your time zone, then you can just listen to the recording. We have a lot of physicians in the class, and they're often doing a procedure. So we have to give it to them. And it's for people for whom the timing doesn't work well. It's at 9 a.m. and 5 p.m. Pacific on alternating weeks. So week 1 is, I think, 9 a.m., then 5 p.m., etc. So that's how the class works logistically. And next. So that's it. This is one of our classes on camera. The registration deadline is August 30. There is a link if you want to sign up. This will get you to more information as well as a sign up. You want to get signed up soon so you don't miss this opportunity. It is only once a year, and we haven't yet had the problem, but we're always aware that we may end up with more people than we want to take. So I want to now open this up to a couple of things. I'm going to introduce Yadara again, and please put your questions in the chat so that we can answer everybody and as we go along. And I'm going to ask you to, if you have a question, to ask it yourself when I call on you and put on your camera so we can see you. So let's get Yadara at the top of the screen. How can we make that happen? Can you wave? If he waves, oh, I know, maybe say something, Yadara.
Hi, everyone. Good evening, good morning.
Hi, and you are in Singapore at the moment, right?
At the moment, I'm in Singapore, yes.
Yeah, great. Okay. All right. Well, thank you for being here. I know it's a reasonable time for you. So let me just do an introduction, and then you can talk a bit about the class and we can answer questions. So I'm going to try this again. Yadara Kularathni. How's that? Better. Okay.
Very good.
Practicing. I've always just called you Yadara. He is an alum from our last cohort. He is co-founder and CEO of a male health company called He Health. He's been doing it for 3 years. It's a startup that detects STTs, so sexually transmitted diseases. And he's very passionate as an MD that he wants to help men with this issue. He's also fairly newly co-founded an AI company in Singapore. He goes, by the way, back and forth between Silicon Valley and Singapore. So he actually has offices here in the Valley. He spent 10 years at Sing Health as an emergency physician. And interestingly, we just met with the board of Sing Health at UCSF. So now I know who they are. Very important in Singapore. And he's a clinical instructor at the National University of Singapore. So, Eudora, why don't you just start off by telling people a bit about what the class was for you and why you took it, how it was, and so on.
Thanks, Stephanie. It's always a pleasure to be here, and I'll give a quick background of who I am and how I entered the entrepreneurship and how the class helped, and most importantly, especially from Stephanie personally, how she helped me to get through tough times and where we are right now in a bit of a successful situation, so that where you can learn. I'll try to keep it simple. I'm a physician with 15 years experience and a clinical instructor in NUS, which is the largest university in Singapore. The turning point was during the COVID. I saw people going through tough times. Even though we had technology, detecting diseases were difficult at the community level itself. So I was thinking, look, we can develop technology for this. But I was a physician and I had no experience of starting a startup in my whole life. I have not done anything other than being a physician. So I thought, okay, let me think of this. And then, of course, fast forward 2022. Actually, Stephanie, I'm from cohort 4, which is
Oh,
2020.
Yep.
Yes. Then I thought, okay, the best way is I start talking to the people. But I was at that time in Singapore, so the local startup community. But I felt there's something missing because what I'm trying to do is something crazy, and I need a little bit of more moral boost. Then I saw in the internet about Stephanie's program, and that's it. I sign up. And yes, I'm one of the crazy people who wake up at 1 a.m. to join the class live for the discussion purposes. Even though it's a recorded one, sometimes I still join because after the class, there's discussion. So I was more interested about that small little part where I can meet the people, talk to them, and so on and so forth. So I make a jump 2022, left academia as a professor and a clinician, started my e-health startup. And it was focused on detecting infectious diseases on the community using AI, artificial intelligence. And our first pick was sexually transmitted infection, which is completely neglected area. And again, fast forward, I learned amazing things. Let me tell 2 things about the most important thing is the connection. And I was new in the game. And Stephanie's class was kind of a mixed with the new and old, and people have experience. Plus, there are a lot of old alumni actually coming to the class, which is very good. They were at different stages of entrepreneurship by themselves. So I will start talking to them, get that. And then also the stories. Stephanie always have on top of the class, inviting few people who've been there, done that, and went through that tough period or good period, and then share their experience. That was like the biggest thing. So that I felt, look, even though it sounds impossible, I can do this. There are other people who have done it, and there were other physicians I met who have done exactly what I did. And I was kind of making my mind, convincing myself to do it. And this is the good part. And also as a startup, as you know, 90% there's doomed to be failed. And I had very tough time early this year. And Stephanie was at the personal level was there. She was guiding me through and asking me, hey, is there anything I can help? Can I give you a call? And she was guiding me through. Fast forward a few months, now we are in a much better position. We venture capital fundraised, but now we are actually EBITDA positive. We expanded products, and my product is being adopted by WHO, CDC in global level. And here we are. I think I couldn't honestly think anybody else than this class, because that was my starting point when I was not sure, convinced myself, and of course, through the connections I built, convinced the world that we can do it. And that's the short story. Happy to share. And I do spend half of my time in San Francisco, and I always plan around so that I can join the on-campus meetings with the cohort. And I have made some amazing friends. San Francisco is a new home for me. And then now I have friends, in San Francisco. Anytime I can hang out, all through this class.
Thank you, Yudara. We
Stephanie?
wish you all kinds of luck with eHealth. It's doing something really important. And I only see one question. Do we have other questions in the chat, or somebody want to raise their hand? I just want to acknowledge Wycliffe Raduma, who's there in the semi-dark because it's the middle of your night, isn't it, Wycliffe?
Yes, it is 3:50, 3 a.m.
Oh
over
my
here.
gosh. Tell people where you are.
So I'm located in Finland, and we are working with hearing health. And what we want to do is come to the US. So I'm trying to get myself also sort of tuned in to working to these kind of two time zones. So I actually sent you an email, Stephanie, saying I won't be able to make it over here because I have a lot of driving to do also the next days. But I'll go take a nap after, and then I'll pick up from there.
Okay, great. All right. Well, Wycliffe is an alum of what cohort?
Cohort 5. And
Oh,
yeah,
the last
I mean,
one.
I found yes, yeah, last cohort, and I find the alumni experience is also really valuable. So I'm really hoping to get more of those, Stephanie. So
Great.
yeah, keep them coming.
Yeah, fantastic. Glad you're here. Yeah. And I see Christina Bonner, or did she just disappear? Anyway, you know, we have alums who just like to be around the group, and that's a really nice thing. Okay, let's see. Michael, you're the only question, so why don't you ask it?
Yeah, hi Stephanie. Thanks for this update. Interesting program. How big is the cohort?
So it varies. I'd say it's someplace between 75 and 110. Depending on what's going on. So, but it's easy to do that when you're all online. You can have a big cohort, and then we break it down into these smaller groups. And I also have, post right after the class, I will create a chat. So we'll go into breakout rooms and maybe put 2 other people or 3 people in a room, and then you get a chance to meet your colleagues. And I'm not sure what motivated the question.
Well, just you learn from the group as well.
Yeah.
And then it's good to know how big the group is. So out of the 10 weeks, most of it is online, and then there's 1 week of coming together. Is that correct?
No, it's all online.
It's all online. Oh, okay.
Yeah. No, nobody needs to fly to San Francisco or drive or whatever. Where are you located?
SF.
Yeah, I thought I recognized that skyline behind you. Yeah. Okay. Okay.
Yeah. Okay. All online. Okay, great.
Good.
Thanks.
Yeah, all online. Yeah. Narjis, do you want to ask your question? I don't know where they are. Maybe not. Well, I will respond to it. Although it's always nice to have the person asking there.
Sorry, hi. Sorry for my sorry,
okay,
I had
great.
some connection issue. Yeah, I'm actually from Toronto, and
Great.
I have already some entrepreneurship experience, and I have my my startup running, but not just very active because my co-founder left a few months back, and because I'm looking for outreaching to US market, I need some connection. I think the connection is a part that others also mentioned that. I have quite busy schedule for the coming fall. I would like to know that if you might have any cohort for winter 2025 as well.
Well, thanks for the question. I have no idea is the answer. So we sort of do this year by year. There's no guarantee that it will be done next year. So if this is something that you think could benefit you, I would encourage you and anyone else on the call, sign up now. It's quite a unique experience. We've not found anything like it elsewhere in the world. And if you're, as you described, doing an early stage startup and have some things you would love to I would think, discuss, get ideas from other people. This is like the perfect place to bring that agenda.
Thank you for your answer. Thanks.
You're welcome. Yeah. I want to say hi to Xu Ying, who's with Sing Health. I forgot that you were on the screen there at this when I was talking about you, Dara, who had once worked in your organization, but nice to see you. You want to say hello to people and tell them maybe they don't all know what Sing Health is.
Yeah, so hi everyone. Hi you Dara. So nice to meet you. So I probably have definitely not met you before. So I just joined Sing Health last year. So we were with a board that visited UCSF just about 2 weeks ago. Was that? Yeah. So we are glad to meet Stephanie and the team, and then really interested to hear about the innovation program, the entrepreneurship program that UCSS offer. And currently, Sing Health is, really very vested into building the entrepreneurship ecosystem within our cluster. There's many PIs and clinicians that are really very keen into translating their work into the commercial side, and will want to know more about, what involved in the startup and what involved in licensing. Yeah, and so it's very, very good to have this program, and Sing Health is really highly interested in, supporting our people, probably supporting them into going to this course as well. Yeah, looking to sponsor like on an annual basis if this is to happen. Yeah, into this course. So really nice to meet everyone here and hear the good things about it, and especially from Udara, yeah, who was from Sing Health, and hearing his journey. I think definitely is good sharing. And in fact, if I may, I probably will connect with you offline. We have a webinar. So our incubator is actually spearheaded by Dr. Danny Belkin. So we just Sing Health started this incubator that supports innovators into the commercial aspect via spin-off. And
You're
it'll be
doing
good to
really-
have.
Yeah, sorry, you're
Yeah.
doing really interesting things there, and we are
Yeah.
very pleased to learn about what you're doing, and welcome
Yes.
people to join
Yeah.
the class. We only have a
Yeah.
couple of minutes left. Is there anyone else who has a question? And again, yeah.
Yeah, so can I add something? Actually, I
Sure.
wanted to say that the entrepreneurship idea that I'm working on is from the time I was studying in Singapore. I did my PhD and postdoctoral fellowship at Singapore, and actually National University of Singapore is my IP holder.
Yeah. Great. Yeah, lots of
Nice.
Singaporean connections
The worm
here.
is this one.
Yeah, the world is small.
Oh, I'm sorry. Udara, thank you for reminding me. I wasn't thinking you're talking about the Hangouts. Do you want to tell people about that?
Yep. So this is something I really like. We almost have monthly hangouts in the university, UCSF itself, where Stephanie arranged with Linda, and any cohort people can join this. So we join, chit chat, share ideas, have some food and snacks, and then, of course, most importantly, you can find people who might have something you need to clear. Like I had some problems one time about some IPs, and then I met this guy who was a lawyer, and then who was a previous cohort, and then I can ask them free. It's free advice. So of course, if you have some common connections, you can make more friends. And then of course, there are a few friends I make, which we hang out for beers and then talk about it. I think for me, San Francisco is a new place. So that kind of nicely get me into the community, make some friends, and so on and so forth. I think that's very valuable.
Yeah, thank you for mentioning that. This is something I think of it in the context of it's an in-person thing at UCSF, so I didn't mention it. But of course, anybody from any of the cohorts is welcome if they're just in town or if they are in San Francisco. And it's great. We bring in a VC sometimes to talk, and a successful entrepreneur did a startup, and people just learned. It's a very casual thing. So. Anyway, I want to thank people for coming. It's just about time. And I will stick around for a bit if anyone wants to just chat informally, or if one of the alums wants to stick around and catch up, I'm happy to do that. But I hope that you will consider joining the class. It's really, and you get an amazing amount of information in 10 weeks, and then you become part of this community, which has benefits that you can't even articulate because you just don't know what they'll be. So it's quite unique in that way. So again, thank you and hope to see you again.